Hello everyone. So in this session we are going to start with the topic of arches of foot, a very important topic, and after covering arches of foot we will continue with the sole of foot, in which I will tell you about the layers of the muscle. So we have got 4 layers of the muscle and individually I will discuss all. So let's start with the first topic, arches of foot. So actually, if we talk about the arches of foot, there is longitudinal and transverse arch. There are two longitudinal arch. One is the medial longitudinal arch and the other is lateral longitudinal arch. Also, there is anterior and posterior transverse arch. So, how it is formed, what are the support system for this arch, and why arch of foot is a very important topic, I will tell you. Actually, there are too many deformities correlated with this topic. So, we will discuss clinical anatomy also. So, what you can see in this image, the red color highlighted line. So, this is showing you the medial longitudinal arch. So, as you can see, it is high arched. If we talk about medial longitudinal arch, it is high arched and it is formed by following bones. So, the important bones, so I just want you to note down. This is the calcaneum bone, which is also called as the heel bone. So, this is the T for talus bone. And we have got the navicular and the cuneiform bones, and we have got the medial 3 metatarsals. Medial 3 metatarsals. So, altogether that means the formation of medial longitudinal arch is from following bones. So, it is formed by the medial aspect of calcaneum bone, the heel bone, the talus bone, the navicular bone, the medial, the 3 cuneiforms, and also by the medial 3 metatarsal bones. So, write on medial longitudinal arch of the foot, bones forming. So, first thing is to know which all bones forms the medial longitudinal arch. The answer is medial longitudinal arch is formed by following bones. And the bones which is taking part in formation of the medial longitudinal arch are following. So, in this category we have got calcaneum bone. So, actually this calcaneum tarsal bone medial aspect, mainly the medial part, the talus bone, the navicular bone, we have got the 3 cuneiform, bones, and the medial 3 metatarsal bone, medial 3 metatarsal bones. So, these are the bones which take part in the formation of medial longitudinal arch. Also in this diagram you can see it is arched. Okay, it is arched. So, actually this arched medial longitudinal arch is important for giving flexibility, and it is very important that that it will not let the medial and lateral plantar nerves to be compressed, and the person who has got a good arch, they are definitely a good marathon runners, and those who have the flat foot, they are not good at walking, running, and their medial and lateral plantar nerve, digital nerves can get compressed. So, let's talk about the important point about the medial longitudinal arch. So, if I talk about medial longitudinal arch, it is also important that we should know exactly the important formation. So, the bones taking part in the formation, what are the pillars and what are the different joints. So, let's talk about the pillars. The next important thing is to know the pillars of medial longitudinal arch. तो अगर हम pillars की बात करें, there is anterior pillar and there is a posterior pillar. There is anterior pillar and there is a posterior pillar, and it is important for us to know that which structure is forming the anterior pillar of medial longitudinal arch and which structure is forming the posterior pillar of medial longitudinal arch. तो अगर हम anterior pillar की बात करें, if I am talking about the anterior pillar, the anterior aspect, so just see this image once again. So, if I am talking about anterior pillar, they are formed by the head of medial 3 metatarsal, and posteriorly it is formed by the medial part of the calcaneum bone. So, that is important. Anterior pillar is formed by the head of medial 3 metatarsals, and posterior pillar is formed by the medial posterior aspect of medial calcaneum, medial aspect of the calcaneum bone, medial aspect of the calcaneum bone. Now, other than that, it is also important. So, we have done with the pillars. Now, we are exactly knowing what are the pillars. We are knowing the important bones which is forming this medial longitudinal arch, which we have already talked about. And other than that, we have to also know about the important joint, and we have to know about the summit of medial longitudinal arch, the superior aspect of medial longitudinal. So all these points are highly important for you. So it is important that you should understand all these points. Okay. So we have already talked about the pillars. Now once again I would like to show you this diagram. I just want to remove these all things because we have already talked about these and I have explained you. The other important point is that so we have talked about this will be the anterior aspect. So this will form the anterior pillar. This will form the posterior pillar. Now other than that, अगर हम summit की बात करें तो summit is formed by the talus bone. So this is what, this is the talus bone, and this talus bone is forming the summit, and it is the most important bone, or you can say this talus bone is called as the keystone of the medial longitudinal arch. Other than that, the main important joint for the medial longitudinal arch is subtalar joint and also the talocalcaneonavicular joint. So here this is T for talus, this is C for calcaneum, and this is N for navicular. So let's talk about that and write important points. Then we will talk about the factors also. Other than that, I would like everybody to just write few important points about medial longitudinal arch. So you can just here itself, if you want, I will just give you 2 important points about this. So the important points are, first thing is that summit. So if I am talking about the summit of medial longitudinal arch is formed by the level of superior aspect of talus. That means talus is the keystone of medial longitudinal arch, and the most important joint of medial longitudinal arch is the talocalcaneonavicular joint, is talocalcaneonavicular joint, and also the subtalar joint. These are the 2 important joints of the medial longitudinal arch. Okay, key joint. Now other than that, I would like to talk about the factors. So for understanding the factors which is maintaining medial longitudinal arch, what I am doing, I am slightly enlarging the image. So when I am enlarging the image, it is quite clear that you are seeing the arch from the medial aspect, which is quite clear in this image. And now we can talk about the factors maintaining. तो अगर factors maintaining की बात करें तो bones है, ligaments है, muscles है, muscle के tendons है, aponeurosis है. These are all very important for the factors maintaining medial longitudinal arch. So here I would like to tell about the sling support. Sling support means supporting the medial longitudinal arch from superior aspect. The sling support is given by tibialis posterior muscle. As you can see, this is the tibialis posterior muscle which is grooving here, and it is correlated with the plantar calcaneonavicular ligament and spring ligament. Other than that, we have got flexor hallucis longus muscle. So अगर हम flexor hallucis longus muscle की बात करें, it is having 3 important function to be performed as a support system. If I talk about, it stretches the arch like a bow, and it is also in this diagram you can see. If I talk about, let me slightly highlight this. So this is flexor hallucis longus muscle, this is tibialis posterior muscle. So if I talk about these two muscles are important for, support, sling support, and you can see the flexor hallucis longus, which is a very important muscle supporting the medial longitudinal arch. As you can see, it is passing beneath the sustentaculum tali. So here you can see this is calcaneum bone. So you can see the flexor hallucis longus muscle is passing below the sustentaculum tali as shown in this image, and it is also supporting the talus as it is traversing from the posterior groove of the talus bone. This is the talus bone. So these are the 3 important function of the sling support given by flexor hallucis longus. Sling support is given by the tendon of 2 muscle, flexor hallucis longus, the most important support system, along with tibialis posterior. Other than that, there is also tie beams which is not letting the separation of medial longitudinal arch, important bones and all. So we have got medial part of plantar aponeurosis which is forming the tie beam support. Other than that, we have got the muscles of the sole. So we have got intrinsic muscles of the soles also which is supporting it. So we have got flexor hallucis brevis, we have got abductor hallucis brevis, which is all giving the support. So let's talk about factors maintaining medial longitudinal arch. So as I have already talked about the pillars, as I have already talked about the important joint and the summit, now I would like to elaborate more, and you should understand which is the other support system of the arches of foot. So यहाँ पे अगर medial longitudinal arch के support की बात करते हैं तो most important bones. So most important bone which is forming the support is the talus bone. अगर ligament की बात करें, if I am talking about the most important ligament which is forming a support for the medial longitudinal arch, the ligament is plantar calcaneo navicular ligament. Along with it, we have also got that is spring ligament which is also called spring ligament, or we have got the other interosseous ligaments which is not letting the separation of the tarsal bone. Other than that, muscles and tendons. The third important support system is the muscles and tendons. So let's talk about the support which is given by muscle, tendons and aponeurosis. So first support which I am talking about is the sling support. तो अगर हम sling support की बात करते हैं तो basic sling support which is given by, the most important sling support is given by flexor hallucis longus and tibialis posterior. So one of the muscle is tibialis posterior, which is acting as a sling support and supporting the arch from above and not letting it collapse, is the tibialis posterior tendon. The other sling support, one more sling support, the other sling support of medial longitudinal arch is given by flexor hallucis longus muscle tendon. When I am using the term flexor hallucis longus muscle tendon, actually this muscle has got, this tendon has got three functions to support the medial longitudinal arch. So I would like to write all these three functions of flexor hallucis longus tendon. So please write down. The first support which it gives is stretches the arch like string of bow, Other support is calcaneum. It also supports the calcaneum bone. So it is also, the flexor hallucis longus is also supporting the calcaneum bone. And the reason is that the flexor hallucis longus tendon is passing below sustentaculum tali. Passing below sustentaculum tali. What is sustentaculum tali? It is a self-like projection of the calcaneum bone. The third is, it is also supporting the talus bone, and it supports the talus bone as its muscle tendon, flexor hallucis longus tendon, grooves the talus bone in the posterior aspect, grooves posterior aspect of the talus bone. So done with this. Now the next support system is the tie beam. So we have talked about the sling support. As you can see, we have definitely talked about the sling support, and the next support which is given by the aponeurosis and the muscles of sole is the acting as a tie beam. So you can just write tie beam. So keeping all the bones and the structures together. So for the tie beam support, we have got following support given by medial part of plantar aponeurosis. Part of plantar aponeurosis. The other support is given by the muscles of sole like flexor hallucis brevis and abductor hallucis brevis muscle. This is flexor hallucis brevis muscle. So these are the support for the medial longitudinal arch which is supporting it as a tie beam. So done with this. Now the next important thing is the lateral longitudinal arch. So अगर हम lateral longitudinal arch की बात करते हैं तो you are seeing the, as you can see, this is less arched. Okay, this is less arched. The lateral longitudinal arch is less arched, and actually the basic function of lateral longitudinal arch is that it is supporting the weight of the body. It is supporting the weight. It is important for the support system. And if we talk about more of the flexibility which is given, the flexibility is given, resilience is given by the medial longitudinal arch, but stability is given by the lateral longitudinal arch. So it is formed by the lateral half of calcaneum, the cuboid, and the lateral two metatarsal bones. Here the lateral part, here posterior pillar is formed by the calcaneum bone, and anterior pillar is formed by the head of lateral two metatarsals. So please write down, lateral longitudinal arch is formed by following bones, and the important bones taking part in the formation of lateral longitudinal arch is lateral part of calcaneum bone, cuboid bone, and lateral two metatarsals, Now talking about the pillars, so I would like to talk about the pillars and the important joint of lateral longitudinal. Most important joint, अगर हमने medial longitudinal arch की बात की थी, so that was subtalar joint and the talocalcaneonavicular joint. अगर हम बात करते हैं lateral longitudinal arch की, तो calcaneocuboid joint is the most important joint. और अगर हम pillars की बात करते हैं, तो anterior pillar, the anterior pillar is formed by heads of lateral two metatarsal bone. और अगर हम posterior pillar की बात करते हैं, तो posterior pillar is formed by lateral part of calcaneum bone. Now, the other important point is to know the summit. So, अगर summit की बात करते हैं, तो summit is formed by the superior aspect of the calcaneum bone, actually the superior aspect, so it is at the level of, it is formed by the superior aspect of calcaneum bone, and it is at the level of, that means it is at the level of subtalar joint, So this is the level where the summit of the lateral longitudinal arch lies. And other than that, अगर joint की बात करते हैं, तो most important joint is calcaneocuboid joint, But I would like to tell the summit, अगर हम summit और joint की तो बात कर ले, लेकिन keystone की बात करते हैं lateral longitudinal arch में, the keystone is the cuboid bone. So if I am talking about the keystone of lateral longitudinal arch, the keystone of lateral longitudinal arch is the cuboid bone, most important bone. Now here again I would like to elaborate about the support system of lateral longitudinal arch. So यहाँ पे भी similar point होगा support system के लिए. We will talk about the bones, we will talk about the ligaments, we will talk about the muscle, tendons and aponeurosis. So the important sling support, as you can see, is given by the tendon of peroneus longus and peroneus brevis muscle. If I just enlarge this, so you can see here in this diagram, these two tendon of peroneus longus and tendon of peroneus brevis you can see, and you can see that the tendon of peroneus longus muscle is arching from the lateral side, grooving the cuboid bone and ultimately attaches to the first metatarsal and the adjoining cuneiform bone. The tendon of peroneus brevis muscle, as you can see, muscle tendon, as you can see, it is also supporting it, and it is attached to the fifth metatarsal bone. So these are the two sling support given for the lateral longitudinal arch. If I talk about the ligament supporting it, is the short and the long plantar ligament as shown in the diagram. Other than that, अगर हम इसकी tie beam support की बात करते हैं, तो that is basically given by the lateral part of plantar aponeurosis. It is given by the flexor digiti minimi muscle, abductor digiti minimi muscle, and also the medial part of flexor digitorum brevis muscle. So here lateral part, sorry, it is by the lateral part of flexor digitorum brevis muscle. So I just want everybody to note down this. अगर हम factors maintaining lateral longitudinal arch की बात करें, तो in this category again I will talk about the bones. Important bone which is supporting it is the cuboid bone, which is the keystone of lateral longitudinal arch. If I talk about the ligaments which is forming the support is the long plantar ligament, and we have got the short plantar ligament. Other than that, we have to also talk about the muscles, tendons and aponeurosis की बात करते हैं. We are talking about the muscles, tendons and aponeurosis, the important muscle. So, we have got sling support. First thing is the sling support. If I am talking about the sling support of lateral longitudinal arch, the sling support is given by the tendon of two muscles, peroneus, longus muscle tendon and peroneus brevis muscle tendon. So, peroneus longus, as you have seen in the diagram, it is traversing from the lateral aspect, grooving the cuboid bone and ultimately attached to the first metatarsal base and the adjoining cuneiform, and peroneus brevis on the fifth metatarsal. Now, talking about the tie beams. The tie beam support is given by lateral part of plantar aponeurosis. The muscles for the adjoining fifth toe, that is abductor digiti minimi muscle, abductor digiti minimi muscle, flexor digiti minimi muscle, flexor digiti minimi muscle, and lateral part of flexor digitorum brevis muscle. Done? So, we have done with this. Now, I would like to talk about the clinical anatomy. So, यहाँ पे जो clinical anatomy, the first thing which you are seeing is the pex planus. So, what is the other name of it? It is called as flat foot. And basically in this case, what happens? The medial longitudinal arch collapses, and because of the collapse of medial longitudinal arch, the foot is touching the ground and it leads to the compression of digital nerves and vessels. So, pex planus, which is also called, this is the condition where there is collapse of medial longitudinal arch. So, there is collapse of medial longitudinal arch and it leads to injury of or damage to digital nerves and vessels, digital branches of nerves and vessels in the sole. And such kind of people is not able to walk for long duration of time. They will complain of pain in the foot. The other condition is pex cavus. Now, in this condition, you can see the medial longitudinal arch is highly arched. So, this is called as high arched foot. This condition is called as high arched foot. So, here in this case, there is exaggeration of medial longitudinal arch. So, pex cavus is a condition where there is exaggeration of medial longitudinal arch. The patient will have exaggeration of medial longitudinal arch. The patient will walk with dorsiflexion of, so the patient, if you will see, will have somewhat extended metatarsophalangeal joint, and that of interphalangeal joints will be flexed. So, there is dorsiflexions, or you can say there will be extension. So, you can say dorsiflexions or slight extension. Other words, extension of metatarsophalangeal joint, and there will be flexion of interphalangeal joint when the person is walking with high arched foot. The other condition is club foot. Club foot can be congenital, and here you can see the baby foot is, the sole is looking inward. So, the foot will be in the position of inverted, the foot will be inverted, adducted and plantar flexed. So, the foot position will be, it is also called as talipus equinovarus. The club foot is also called as talipus equinovarus. In this, the foot is inverted, the foot is in inverted position, the foot is in adducted and plantar flexed position, adducted and plantar flexed position. Done? Now, let's talk about halus valgus. When I am using the term halus valgus, what you can see, this is the great toe. So, you can clearly appreciate in this diagram, the great toe is deviated at the metatarsophalangeal. So, you can see lateral deviation of the great toe at the level of metatarsophalangeal joint. So, in this condition, there is lateral deviation of great toe at first metatarsophalangeal joint, and actually the reason is the person is wearing high heels for long duration of times, and the patient will also have the formation of adventitious bursas in this condition by union. So, that is adventitious bursae is formed, which is seen in this condition. The other condition is hammer toe. In case of hammer toe, what you can see, there is flexion at the PIP, proximal interphalangeal joint, but there is extension at the distal interphalangeal joint and that of metatarsophalangeal joint. And hammer toe, generally second toe is more commonly involved. And in this case, the patient will have extension, or you can say hyperextension, extension or hyperextension at metatarsophalangeal joint and that of dorsal interphalangeal joint. But proximal interphalangeal joint is acutely flexed in this condition. So, we have done with the clinical anatomy of the longitudinal arches of the foot. Other than that, before proceeding to the transverse arch, I would like everybody to know about also a slight comparison to be done between the medial and lateral longitudinal arch. So, we have completed this topic, but I want that a quick comparison can be done between these two arches. So, let's talk about, so one side you can write medial, another side you can write lateral longitudinal arch. So, that means medial, this is medial and this is lateral longitudinal arch. So, just a comparison, like first point is bones. So, how many bones? So, more bones form medial longitudinal arch and comparatively less bones form lateral longitudinal. If you remember, in the first image only I have described that the calcaneum medial part, the tail is the navicular, the medial 3 cuneiform and the medial 3 metatarsal forms the medial longitudinal arch. The lateral part of the calcaneum cuboid and the lateral 2 metatarsals are forming lateral longitudinal arch. The most important joint in case of medial longitudinal arch is the talocalcaneo navicular joint and also the subtalar joint, but here it is calcaneo-cuboid joint. One of the important point is that the lateral longitudinal arch is more rigid, so there is rigidity. It is important for weight transmission, balance and support, but the important function, if I talk about the functional stability and all, it is more of flexible. The more flexibility is given by the medial longitudinal arch. The other important point is the most important bone की अगर बात करें medial longitudinal arch में, the most important bone is talus and the most important bone here will be the cuboid. As you can say, the you can also write the keystone of lateral and the keystone for medial. The most important this is very important for that support. The most important ligament supporting it is the spring ligament, or you can say plantar calcaneo-navicular ligament, plantar और यहाँ पे जो most important ligament supporting is the long and short plantar ligament. Actually, already the difference of sling support, tie beams and different ligaments supporting it has been discussed. So, this is the major difference. Now, let's move on to the transverse arch. If I talk about transverse arch, there is two transverse arch. There is anterior transverse arch of foot, and there is a posterior transverse arch of the foot. ओके तो अगर हम एंटीरियर एंड पोस्टीरियर ट्रांसवर्स आर्च ऑफ फुट की बात करते हैं तो इट इज इंपॉर्टेंट बेसिकली दीज आर्चेस अगर बात करते हैं तो इट इज फॉर्म बाय द बोन्स ऑफ द फुट द टार्सल एंड द मेटाटार्सल बोन्स व्हिच इज फॉर्मिंग इट एंड इफ यू विल सी द एंटीरियर आर्च इट इज एक्चुअली कंप्लीट बिकॉज इट इज फॉर्म बाय द हेड ऑफ द मेटाटार्सल बोन्स एंड द पोस्टीरियरली it is incomplete. When the two foot come close to each other, the posterior arch is formed, otherwise it will be like a half dome. So you can just see this. So you can see anterior transverse arch is formed by head of all the 5 metatarsal bone. Posterior arch, and it is a complete one. It is a complete one. Posterior arch is incomplete. It completes only when both foot are on the ground. When both the foot is on the ground. So that is the reason. And other than that, अगर हम transverse arch की बात करते हैं, so just a minute. Yeah. So the important point of a transverse arch is the bones which is forming the support is mainly the metatarsal bones. So actually the tarsal bones is the shape, they are wedge shaped, they are also forming the support, the metatarsal bone, the tarsal bones are all supporting it. अगर हम ligaments की बात करते हैं, most important ligaments which is supporting it, the important ligaments are superior and deep transverse metatarsal ligaments. So there is superior transverse metatarsal ligament which is supporting it, and we have got deep transverse metatarsal ligament which is supporting it. Other than that, it is also important to know the other support like tie beams and intersegmental. So we should also know about the important tie beams which is supporting it. The important tie beams, so ऊपर में आप लिख सकते हो transverse arch. We are talking about which arch? We are talking about the transverse arch. So important tie beams which is forming the support, which is not letting the individual bones to get separated, is formed by the muscle tendon, that is peroneus, longus muscle and tibialis posterior muscle. So this is an important tie beams. Other than that, there is also intersegmental tie beams. There is intersegmental tie beams which is supporting the neighboring bones, tarsals and metatarsals. So we have got dorsal interossei muscles as the tie beams, intersegmental tie beams. Okay, and the major tie beams which is not letting the bones of getting separated is the tendon for the peroneus longus and tibialis posterior. Now talking about the sling support. Sling support for transverse longitudinal arch. The important sling support for the transverse arch is following. So the sling support is given by tibialis anterior muscle and by peroneus tertius and peroneus brevis muscle. So actually this peroneus tertius and peroneus brevis muscle is giving the sling support laterally, and this tibialis anterior is giving the sling support medially. So basically these are the certain support system of the transverse arch. So in short, we have finished with the topic of medial and lateral longitudinal arch, and we have also talked about the transverse arches. What is next very important topic which I want to discuss? Actually, why it is important? Because it's a very easy topic. You have to not know the individual muscles in much more detail, but it is important that you should know about the layers of the muscles of soul. So we have to know about the muscles of the soul. So I would like to tell you that there are 4 layers of the muscles in the soul, and already a few of these muscles we have already discussed when I was discussing the compartments of the leg. So we'll go one by one. So this is an image where you can see the muscles of the first layer of the soul. So यहाँ पे हम देख सकते हैं muscles of the first layer of the soul is abductor hallucis, flexor digitorum brevis and abductor digiti minimi. So we have got 3 muscles in this category: flexor digitorum brevis, abductor hallucis and abductor digiti minimi. How you are going to remember it? एक एबडक्टर है जो कि मीडियली और लेटरली है, तो वन एबडक्टर मीडियली लेटरली, हैलोसिस इज मीडियली एंड डिजिटी मिनिमी फिफ्थ टो इज लेटरली. उस दोनों के बीच में है फ्लेक्सर डिजिटोरम ब्रेविस. सो द मसल्स ऑफ फर्स्ट लेयर. सो वन बाय वन वी विल टॉक अबाउट दिस. जस्ट अ मिनट. या, so we can talk about the muscles of first layer, then we can move on to the muscles of second layer. So actually for the innervation of these muscles, I will at the end tell you about actually the muscles of the soul are getting innervation from the terminal branch of the tibial nerve, that is medial and lateral plantar nerve. So at the end, after completing this muscle, I will give you the list of muscle being innervated by medial plantar nerve and the lateral plantar nerve. Now here individually I will tell in brief about the individual muscles. So 3 muscles hain. I already have shown you the name. So we are talking about the 3 muscles of the first layer. So please write down the name. And the name are flexor digitorum brevis muscle. Then we have got abductor hallucis muscle. Then we have got abductor digiti minimi muscle. So these are the 3 muscles, and one by one we will discuss the individual one. So let's start with the first muscle. Muscles of the first layer. The first muscle in this category will be flexor digitorum brevis. Which muscle is this? Flexor digitorum brevis. Flexor digitorum brevis. So अगर flexor digitorum brevis की बात करते हैं तो this muscle is originating from, so flexor digitorum brevis. So अभी कोई डाउट ही नहीं है, जब digitorum बोलिए तो ये टेंडेंस कहाँ जाएगा? लेटरल 4 टोज में जाएगा इंसर्ट होने के लिए एट द बेस ऑफ प्रॉक्सिमल फैलिंक्स. अगर ऑरिजिन की बात करें तो इट इज ऑरिजिनेटिंग फ्रॉम मीडियल ट्यूबरकल ऑफ कैल्केनियम. It is originating from medial tubercle of calcaneum bone. और अगर आपको नाम याद है तो you can very easily know about the attachment. अभी हमने बोला digitorum, तो it is going towards the lateral. So the tendons, it goes as a tendons for the lateral 4 toes. And exactly it is important to note down that it is splitting. These tendons are splitting at the base of proximal phalanx. No one is going to ask you such detail about individual muscle, but you should have an idea about this. So agar digitorum brevis hai, so flexing the lateral 4 toes. What will be the action? They are involved in the movement of lateral 4 toes, that is flexion of lateral 4 toes. Now let's talk about the second muscle in this category, abductor hallucis. Abductor hallucis. What do you mean by the word hallucis? Means the great toe. That means the action will be abduction of the great toe. And attachments की बात करते हैं. So let's talk about the attachment. So if we are talking about the attachment, it is attached to medial. It attached to medial and lateral. So basically it is attached to medial tubercle of calcaneum. It is originating from medial tubercle of calcaneum and flexor retinaculum of the foot. And from the flexor retinaculum of foot. और अगर हम insertion की बात करते हैं तो ये hallucis है. So definitely it is going towards which toe? It will be going towards the great toe. So अगर हम abductor hallucis की बात करते हैं तो it fuses with the tendon of flexor hallucis brevis. Flexor hallucis brevis, and the action is abduction of great toe. The third muscle in this category of the first layer is abductor digiti minimi. Abductor digiti minimi. Now, abductor digiti minimi की origin की बात करें तो it is originating from medial and lateral tubercle of calcaneum. Medial and lateral tubercle of calcaneum. Insertion की बात करते हैं. If I talk about the insertion attachment, so it is again the fifth. So here flexor hallucis brevis, abductor digiti minimi. So it is, if I talk about abductor digiti minimi, it fuses with the tendon of flexor digiti minimi brevis. Flexor digiti minimi brevis. Okay. So that is all for the first layer of the muscle. The three muscle, flexor digitorum brevis for the lateral four toes, one medially abductor hallucis, one laterally, that is the abductor digiti minimi. Abductor digiti minimi is merging with the flexor digiti minimi brevis. The abductor hallucis is merging with the tendon of flexor hallucis brevis. Done with this, action according to the name, nerve supply at the end I will tell you. Now, muscles of second layer. Now, we are talking about the muscles of the second layer. So, I just want to enlarge this. So, this is layer 2 of the sole, and in this category, we have got following muscles. Flexor hallucis longus and flexor digitorum longus muscle. So, these are the two muscles which we have already talked when we are talking about the posterior compartment of the leg, and we have talked about the attachment. यहाँ पे जो new muscles मिल गए हमें वो है quadratus plantae and lumbrical muscles. Actually, quadratus plantae is also called as the accessorious muscle, flexor digitorum accessorious and lumbrical muscles. So, exactly, firstly, I want everybody to write the name of the muscles of second layer. So, write on the heading, muscles of second layer of the sole. Muscles of second layer of sole. Muscles of second layer of sole. There are four muscles in this category. Two we have already done, that is flexor hallucis longus and flexor digitorum longus. These are the two muscles of posterior compartment of the leg, and two new muscle which we have to discuss here is the flexor digitorum accessorious muscle, which is also called as quadratus plantae muscle, and we have got lumbrical muscles of the foot. So, done. So, one by one we will talk about this. So, let's talk about quadratus plantae muscle. Actually, quadratus plantae muscle is also called, what is the other name which I want everybody to understand? This is quadratus plantae muscle. The other name is, please write down, it is also called as flexor digitorum accessorious muscle. Now, अगर हम इस मसल की बात करते हैं तो it is actually having two heads of origin. So, it is this muscle is having two heads, that is it is medial and lateral aspect of calcaneum से arise होता है. And if I talk about insertion, so it is inserting into, it inserts into along with the tendon of flexor digitorum longus. So, it is inserting into the tendon of flexor digitorum longus muscle. Now, okay. So, done with this? Okay. So, already we are talking about, so exactly जो हमारे दो मसल है फ्लेक्सर हालोसिस लॉन्गस एंड फ्लेक्सर डिजिटोरम लॉन्गस और ऑलरेडी डन. वी हैव गॉट lumbrical muscle. So the lumbrical muscle will be exactly lumbrical muscles will be exactly similar to that of the muscle which we have discussed already in the hands. So that is very important, and it's important that you should also know that अगर हम अगर हम lumbrical muscles की बात करते हो तो medial lumbricals are unipinnate and lateral lumbricals will be bipinnate. Actually they are just similar to that of the muscles of upper limb. तो lumbrical muscles का action होता है flexion at the metatarso. So this will cause flexion at metatarsophalangeal joint and extension at interphalangeal joint. So this action will be also similar. Now I am not going into details of the flexor hallucis longus and flexor digitorum longus once again, because we have already discussed these two muscles. So why I will tell you, this is the first muscle in this list, then we have got the second muscle in this list, then we have got third and fourth. Actually these two has been done when we were discussing about the compartments of the leg. Okay, so exactly this merge. So exactly ये जो हम अगर बात करते हैं this muscle which is the accessorious muscle, it inserts with the flexor digitorum longus, and actually it merges with that of the toes, lateral four toes. That is an important point. So let's talk about the so we have done with this. Now I would like to talk about the muscles of third layer. So we have done with this already. So let's talk about the third layer muscle. So let's talk about the third layer muscle. So if I am talking about the third layer muscle, the first muscles are flexor hallucis brevis. We have also got the other muscle, that flexor digiti minimi brevis, and we have got adductor hallucis muscle. Which muscle? Adductor hallucis muscle. So it's important that we should go into the details of all. So firstly, I want everybody to write down the name of these muscles. So muscles of the third, you can just write here third layer. यहाँ पे क्या लिख सकते हैं? Third layer muscles, and write down the name. So muscles of third layer is following. So we have got flexor hallucis brevis muscle in this list. We have got flexor digiti minimi, flexor digiti minimi brevis muscle. We have got adductor hallucis muscle. So actually these are the three muscles which is the muscles of third layer, and we will talk individually about this. So let's talk about the first muscle of this category, that is FHB. What is this? Flexor hallucis brevis muscle. This is flexor hallucis brevis muscle. So actually it is a Y-shaped muscle. It is a Y-shaped muscle, flexor hallucis brevis. So you can just see also here in this diagram, if I just enlarge this. So we have already done with this. So you can see this is a Y-shaped muscle. This is a Y-shaped muscle. So flexor hallucis brevis is having a lateral and medial limb. So lateral and medial limb is from the so its lateral limb is from the part of cuboid bone, and medial limb is from the cuneiform bone, and inserts on the proximal phalanx of the big toe as shown in the image. So write down, it is a Y-shaped muscle having lateral limb and having a medial limb. The lateral limb is arising from the medial part of cuboid bone, and the medial limb is arising from the lateral aspect of cuneiform bone. And अगर हम insertion की बात करते हैं, if I am talking about the insertion of this muscle, so done with this insertion of this muscle. If I talk about insertion, so its tendon inserts into the proximal phalanx of big toe, in the proximal phalanx of big toe. It inserts into the proximal phalanx of big toe. So done with this. Now let's talk about the next category of muscles. So we have already talked about the muscles of the first muscle of the third layer. Let's talk about the next muscle. So the second muscle in this list is flexor digiti minimi brevis. Flexor digiti minimi brevis. So अगर flexor digiti minimi brevis की बात करें, so digiti minimi means the little finger, the fifth toe के side में है, तो it is originating from the base of fifth metatarsal bone और अगर हम insertion की बात करते हैं, if I talk about the inserts, so it is inserting onto the lateral side of base of proximal phalanx of little toe. Proximal phalanx of little toe. Little toe or the fifth toe. So now the third muscle in this category is adductor hallucis. So if you remember, there was same kind of muscle in the upper limb also, that was adductor pollicis. So adductor hallucis की भी जो categorization, it will have an oblique head and it will have a transverse head. If you want to see the image, you can see here. Just rub this, then you can see here we are talking about adductor hallucis, which is having a oblique head and which is having a transverse head. So this is the transfer and this is the oblique head. So if I talk about, just enlarge this, if I talk about the two heads, you can see the larger is the oblique head, and the oblique head is from the base of second, third and fourth metatarsal bones. As you can see, the transverse head is from the metatarsophalangeal joint. As you can very nicely appreciate, the small transverse head is from the it's also from the ligaments. It is from the third, fourth and fifth toe. So it is from the, exactly, it is from the third, fourth and fifth toes. And flexor hallucis brevis, this we have already done, and we already know that flexor hallucis brevis has got sigmoid bone in it. But if I talk about adductor hallucis here, you can clearly see it is inserting, adductor hallucis, if you will see, it is again inserting into the great toe. GT means great toe, and it is inserting into the great toe, that is the proximal phalanx lateral side of the big toe. So please write down. So write down, adductor hallucis is having an oblique large head which is arising from the base of second, third and fourth metatarsal bone. Metatarsal bones. Transverse head, which is a small head. Transverse head, which is a small head. It is arising from plantar ligaments of metatarsophalangeal joint of third, fourth, fifth toes. And what about the insertion? The insertion of adductor hallucis muscle is, if I talk about the insertion of adductor hallucis muscle, it is inserting onto the lateral side of base of proximal phalanx of the big toe or great toe. It is inserting into the proximal phalanx of the great toe or big toe from the lateral aspect. So now we have done with this. So in this category, we have finished with the muscles of third layer. Now the category is the muscles of fourth layer. So let's talk about that. अब हम बात करेंगे muscles of fourth layer. Now we will talk about the muscles of fourth layer. So अगर fourth layer के muscles की बात करें, तो let me show you an image. So if I enlarge it, you can see the introcei muscle, the tibialis posterior and peroneus longus muscle. Peroneus longus muscle is a muscle of lateral compartment of the leg and already discussed. Tibialis posterior is the muscle of posterior compartment of leg, already discussed, and introcei muscle. Actually, there is dorsal and plantar introcei, which will be similar to that of upper limb. So fourth layer muscles are tibialis posterior, peroneus longus muscle, and we have got plantar introcei and dorsal introcei. We have got plantar introcei muscle and we have got dorsal introcei muscle. Actually, to be more specific, there is 3 plantar introcei muscle and there is 4. there is 3 plantar introcei muscle and there is 4 dorsal introcei muscle. So I would like to discuss about the muscles mainly. अगर यहाँ बात करें तो peroneus longus muscle and tibialis posterior has been already discussed in the compartments of the leg. तो यहाँ पे हम dorsal introcei muscle की बात करेंगे. And we know that it is similar to that of the muscle of upper limb. The dorsal introcei will be morphologically bipinnate and it is arising from. So exactly अगर हम बात करते हैं dorsal introcei muscle की तो it arises from adjacent sides of metatarsal bones. That is 1 to 5. 1 to 5 के adjacent side से arise करता है. We have got 4 dorsal introcei muscle and the first will insert on medial side of proximal phalanx of the digit, and if I talk about second to fourth, they will insert on lateral side of 2 to 4 digits. Now अगर हम plantar introcei की बात करते हैं तो please write down about plantar introcei. So what is plantar introcei type? It is unipinnate. It is morphologically unipinnate. Morphologically it is unipinnate and it arises from medial sides of metatarsal bones. That is 3rd to 5th. इंसर्शन की बात करें तो ओनली 3 कितने होते हैं प्लांटर इंट्रोसिया? 3 होते हैं और डॉर्सल इंट्रोसिया कितने होते हैं? 4 होते हैं. तो एग्जैक्टली इंसर्शन की बात करें तो इट इज इंसर्टिंग इनटू द मीडियल साइड ऑफ द बेस ऑफ 3rd to 5th digits. So done with this. So in short, we have finished with all the muscles of the 4 layer of the soles. Now, before traversing, we have done with all these muscles, but I would like to tell that if I talk about tibialis posterior, already done. So already it has been completed in the leg. Same way peroneus longus is already completed in the muscles of the leg. So even once again I am not going to complete it. You can just revise it from compartments of the leg. So यहाँ पे lateral plantar nerve का innervation है. So if we talk about the lateral plantar nerve, it is innervating following muscles. It is innervating digiti minimi, abductor digiti minimi, flexor digitorum accessoriosus. It is giving innervation to adductor hallucis, introcei muscles, lumbrical muscles. Exactly first lumbrical को छोड़ के second, third and fourth lumbrical is getting innervation from lateral plantar. Now, so basically lateral plantar nerve is giving innervation to major muscles of the sole. So it is giving innervation to the flexor digiti minimi brevis. It is giving innervation to flexor digitorum accessorius. It is giving innervation to abductor digiti minimi, second, third and fourth lumbrical muscle, the palmar introcei and dorsal introcei, and also adductor hallucis muscle. अगर medial plantar nerve की बात करें, if I am talking about just 4 muscles are innervated by medial plantar nerve, and that is abductor hallucis, flexor digitorum brevis, flexor hallucis and the first lumbrical muscle. So obviously medial side का innervation होगा तो medial side के sole muscles कौन कौन से हैं? Abductor hallucis, flexor digitorum brevis, flexor hallucis brevis and also the first lumbrical muscle. Now, after this, I want to discuss few of the MCQs related to the topic. So, let's start with the muscles of the first layer of the sole are all except. The option given is abductor hallucis, flexor digitorum brevis, abductor digiti minimi and that of extensor digitorum brevis. So, exactly this digitorum, extensor digitorum brevis is the right answer because it is not the muscle of the sole of foot, which is not inserting into the plantar aspect of the foot. So, the muscles are flexor hallucis longus, peroneus tertius, flexor digitorum longus. Exactly, ये जो question है, it is correlated to the muscles of the leg and that will help you to understand. So, in the sole only we have seen the tendons of flexor digitorum longus, flexor hallucis longus, peroneus longus. Peroneus tertius is the right answer because if I talk about peroneus tertius, it inserts onto the dorsal surface of fifth metatarsal, fifth. So that is the right answer. Other than that, all muscles are the muscles of second layer of the sole except flexor digitorum accessorius, lumbrical muscle, flexor hallucis longus, flexor digitorum brevis. 4 options are there and we have to mark the right answer, which is not the muscle of second layer. Question number 4. So exactly अगर हम बात करें flexor digitorum brevis is the muscle of first layer. Flexor digitorum brevis, अगर हम flexor digitorum brevis की बात करें तो it's the muscle of first layer. It is the muscle of first layer. Other than that, flexor digitorum accessorius, flexor hallucis longus, lumbrical is all the muscles of second layer. Medial plantar nerve innervates all except. So we know that just the 4 muscles are getting innervation from medial plantar nerve, and definitely the correct answer is adductor hallucis. Adductor hallucis is innervated by lateral plantar nerve. Rest all abductor, flexor hallucis, flexor digitorum brevis is innervated by medial plantar nerve. How many plantar introccei are present in the sole? So, as I told you, plantar introccei, which is unipinnate, dorsal introccei is bipinnate. We have got 4 dorsal introccei in the sole and we have got just 3 plantar introccei in the sole. So, we have got 3 as the right answer. So, yes, done with this. All the best and keep studying. I will again come up with the new topic of the lower limb with this series. All the best, keep studying. Any doubt, you can connect to me. Thank you.